For the next portion of the program, Dr. Gagn and I would like to give you a little bit of an update and review on what's happening and some of the evolution with the SAGES videos. Dr. Gagn is Director of Bariatric Surgery, West Penn. Talk a little bit about the top 21 and Pearl's components of SAGES videos.
Thank you, Dr. Brunt. No disclosures. The top 14 is no longer the top 14, it's the top 21. I'll also be reviewing some of the Pearl's step-by-steps programs and the SAGES postgraduate courses in video library, and Dr. Brunt will discuss the Grand Round Master Series that are available. There's a lot of evolution that has been going on between video monitors, primitive instruments, and unfortunately sometimes we do have to convert to open surgery. But our goal is to prevent that and have our residents learn as much as possible in the shortest time as possible. It really is a limited time between the residency and even fellowships, 8 hours a week in some programs, 20 hours of that is spent in the cafeteria. I won't discuss Dr. McGinty here, but what the nice thing with the videos, it gives the residents and fellows a lot of time to learn on their own time. There's some good educational theories behind all that. It's just really that whole idea of see one, do one, but mental imagery, really knowing what they have to do inside the operating room and without being in the operating room, where once they imagine what their hands have to do, then their motor skills do improve even without having the physical practice. And also there's a lot of data with video-based education for acquiring the skills and also retaining the skills if they haven't done it in a while. And also by video-based education, there's a number of papers and literature that really shortens that learning curve, both in open cases as well as laparoscopic cases. But it really is enforcing that with the residents that the more they do, the better. And this is one good paper from Dr. Henneford's group, dividing medical students, really people, true novices, and almost like most interns and even some fellows when they come into advanced laparoscopic programs, dividing in the medical students into 3 groups. Those who watched the videos the most had better outcomes. They just had more proficiency in the shorter amount of time. So the important thing is you can observe a lot just by watching. And even here, Yogi Berra started with a 3D glasses reading comic books. He's moving his lips though. So it is, anybody who's ever trained with me, the residents, it is tough love, but watch the video. I tell them all the time, watch the video, to see many and then do one. Instead of seeing one, do one, and teach one, see many. And it's active study of the videos, not passive, and the more to watch, the better. And there's a quote from that movie, Searching for Bobby Fischer, don't move until you see it. And that way, do you have a mental image of what you want your hands to do instead of just floundering in there. If you know what you want your hands to do, they'll do it. But really reinforcing that with the residents. Over the years, there has been evolution in the SAGES top minimally invasive procedures, what every resident and practicing surgeon should know beginning in 2001 to present day. Back in 2001 was the first top 12 procedures that every resident and surgeon should know, from flexible endoscopy procedures to lap chole, and then the top 14 procedures in 2004, and then next an example of the very same procedure when done correctly. That's my first patient leaving the room. But now it's the SAGES top 21 procedure every practicing surgeon should know, and that's being released now. And it's released by Cinemed, and there's new authors, new commentators from the older procedures, the older editions, which are, all, again, always complementary. But upper endoscopy, Dr. Marks doing colonoscopy, cholecystectomy, common bile duct exploration, Nissen fundoplication, paraesophageal hernia repair, Heller myotomy, inguinal hernia repair, ventral hernia, splenectomy, adrenalectomy, Dr. Brunt, right hemicolectomy and appendectomy, sigmoid, gastric bypass, gastric band, ultrasound, distal pancreatectomy, liver biopsy, esophagectomy, gastric resection, and treatment of peptic ulcer disease. Again, it's a great resource for residents, again, some of the simpler procedures for the lower level residents and more advanced procedures for the upper level residents and fellows. And it's really great to have these available. I just talked to a few of my older residents I trained over the years, and they still have been going back to these, just if they haven't done a procedure in a while, using this as a reference point. But each procedure is presented by an expert laparoscopic surgeon with a PDF commentary by offering other insights from other surgeons. The new DVD plays on TV as well as computer, and for the first year there's online access to these as well, which means viewing videos anywhere from the internet access, which means everywhere. The other series that's been very successful is the Sage's Pearls step-by-step, which were all surgical procedures are broken down into the basic steps of the procedure, step-by-step, and as many of you know, these steps have different ways of doing it. And so there's multiple authors, examples, and perspectives on how to do each of these procedures. So there's more than just one way, more than one treatment option at such as a horse hospital. In the inguinal hernia repair, again, left inguinal and direct inguinal hernia repair, dissection, skeletonizing the cord, and just every step by step from simple procedures to the more advanced procedures of gastric bypass. Again, with multiple contributors explaining the way they do it and video demonstrations of these. And there's laparoscopic bypass, Nissen fundoplication, inguinal hernia repairs, right hemicolectomy, and sigmoid resection available. Again, with more advanced procedures, more viewings the better. Simple procedures may require 1 or 2 visualizations by the residents, but more advanced procedures definitely need more viewings to know what they need to do. And I always think, where were these when we were in training? It really was sort of human experimentation, and hopefully the people beneath us, behind us, can learn more from that. And talking to Dr. Brunt, I'm a musician at heart, just happen to be a surgeon. The same applies for music education. What's available now compared to 10, 15 years ago is tremendous, so we can advance a lot more quickly. Also going with that, mistakes it could be that the purpose of your life is to serve as a warning to others. And so we do learn from our mistakes, I think, more than from when things go well. And the Sage's postgraduate courses are also available, and it's really nice to, when the surgeons on all of these DVD sets and postgraduate courses really have the experience, they've seen it, they've had the troubles, and how do they manage it. And that's often the hardest part. Again, maybe not for lower level residents as much, but definitely for upper level residents once they get some technique, or even how to recognize some of the problems in patients. Also available is the gastroesophageal reflux disease and complications. And besides the bariatric surgery and the gastroesophageal reflux disease, right now the other postgraduate courses occurring today are also going to be available on DVD. That's challenging hernias and laparoscopic surgery for inflammatory bowel disease. Also minimally invasive surgery and cancer, debate, and from top to bottom gastroesophageal reflux disease and laparoscopic colon course. Also available at a reduced price will be the Understanding Your Video System, what to do when the lights go out, and also the Surgeon in the Digital Age, which is the PDA workshop for surgeons. And again, these do have are on DVDs, but also online access. And I think most residents nowadays, they know how to use the phones and their smartphones a lot better than most of us, and observe, as Dr. Mutter had mentioned, on their PDFs, on their personal digital devices. Also, I think for residents and especially for fellows just finishing their training, to understand that there are the patient information brochures available, so they don't have to reinvent the wheel when it comes to distributing information for their patients. So there's several video sources available for resident and fellow education. Materials are available, not only DVD, but also online access. And I think more and more of the residents I see are using online access as quick, easy, and really short attention span. 9 minutes, my attention span is probably more like 2 minutes. But it's really nice to be able to have that as a quick access. And to be able to incorporate these into the surgical curriculum for residents, make the DVDs available and accessible easily for residents. If they're hard to get, they're not going to look at them. But you know, whether it's library sign out, have them in the MIS lab, a resident computer room, or use it as a conference where there's an active discussion, where there's active listening and active participation, as well as online access and the smartphones. And also, one thing I've noticed that helps with the resident education is having the staff make their own videos as well, teaching videos and how they want it done, to learn outside the operating room and outside the hospital, because it's all self-education. And for those who know me, I say I got my education, or I trained one place but got my education elsewhere, because it really is self-learning and making sure the residents understand that from the start. Thank you.